I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. My guest today is a dear friend and a wonderful person who works in this field, Deb Davis. Welcome, Deb.
Thanks, Craig. Thank you very much.
Tell us a little bit about how you got involved in this field.
Well, ironically enough, I knew nothing about the field of IDD. I look back and I think about the people that in high school, maybe I think at the time we called them the learning disabled community. And people in that class, I never thought about what happened to them after high school. And when I became a nurse, and it was later in life, in 1999, I never felt like I found my niche, where I needed to go. And so I worked cardiac, I did home health, long-term care. I managed the platelets program for the Heart of America Red Cross blood region and thought, oh, that's pretty cool. But then I didn't feel like that was really home. And somebody said to me, you know, there's a place in Pekin, Illinois, I live in Illinois, that is hiring. You might want to go there. And I didn't know anything about providing those supports. So I went. And
like many of us, we didn't know much about the field.
Or trial by fire for sure. But I went there and I did the interview, and I always teased and said they played dirty pool because they took me into their day program, and I got to meet some of the people. And I remember one person in particular, a younger gentleman. You could tell there was some social anxiety, so he would kind of come and stand nearby but look away. And when there was an opening, he said, so how are the kids? Yes, he wanted to talk. And I just thought, I need to know more about people with intellectual and developmental disabilities. Maybe I would like this. And of course, then they offered me the job and told me what it paid, and I laughed and went home. And fortunately, they called me and they offered me some more money. And it was immediate that I knew this is where I needed to be. This was the field for me. And I knew nothing, so I was as green as could be. I was played like a fiddle, They could get anything from me at first. We had a lot of unnecessary ER visits, I think, at first because I didn't know.
And that also is a very common story and something that we share as well.
Yep.
Yeah, I get it.
Yeah, it was fun. And in 2010, that was in 2006. In 2010, I decided to get my certification. I became involved in DDNA pretty much when I started because one of the other nurses there said, hey, this organization is great. You can get good information.
So for our listeners, DDNA is the Developmental Disabilities Nurses Association. We're actually talking together at the conference, at their annual conference in New Orleans right now.
Right.
Yeah. So tell me about the DDNA certification. What made you want to do that, and what does it mean to you?
It means to me that I took the time to do research. And believe me, that was kind of hard to do because there's not a lot of information out there. There's a pretty big textbook, and who has time to read that in this field because you're on call 24/7. And there was, I think, a small book by Dr. Tyler from the Cleveland Clinic.
Yep.
But there really wasn't a lot of good information. So anytime I could get information about any of the syndromes, I went to all the websites and I wrote everything down. And, I thought, I want to be an expert in this field. I want to know what I need to know to be successful because I certainly felt unprepared for this field. And after, 4 years, I thought, I'm going to be an expert in this field if it kills me. I'm going to take this test.
Well, thank goodness it didn't kill you because you've done a tremendous amount of work in this field in a lot of different areas. So tell us about some of the roles you've played, some of the jobs you've had in this field.
Well, I've been a registered nurse trainer for Illinois, so I could work for providers and train people to care for people with IDD and to not be afraid and to be able to trust that they needed to call me and let me know what's going on. which then created a great deal of PTSD from being on call.
I remember the days of being on call endlessly, it seemed like, yeah.
Yeah, as a matter of fact, I did a brief stint before joining my last job I managed the brain injury waiver for an MCO in Illinois because I thought it was similar and I could get off call. And it was, but it took me 4 months not to wake up in the night thinking I heard the on-call phone ring. And I really, really missed the IDD field. And then I got a chance to work for Intellectability and also provide training almost nationwide instead of just one state on how to provide
That's where
good
Definitely
care.
I got to know each other.
Yeah.
Yes. So what did you do at Intellectability?
Yeah, I'm enjoying having some more time home with my husband, and we're certainly at an age where we can be retired. But, I have to keep my toe in it a little. So right now, Intellectability is being kind enough that they're going to let me continue to train person-centered thinking once a month. They actually helped me get credentialed in that through my role.
And you've had a few roles or a few different responsibilities in the field, and one of them that you mentioned was the person-centered thinking training that you do. Tell me about that. What does that encompass? Tell everyone about that.
Oh my gosh, that is one of the neatest trainings. We all think we're person-centered in this field. We do, and we're not until we really stop and think about it. It helps us really look at a person more as a person and to slow down and to stop trying to solve problems until we've really looked at them and determined they are a problem. Because as a nurse, my personality is to fix things and move on to the next thing, right? Yeah. Okay, move on to the next thing. But, people don't want to be fixed. People want to be supported. So it really helps me look at people differently.
Let me ask you about the person-centered training, because what that involves, or being person-centered, often means including what the person wants for their own lives, right? To be included in the mix of what's good for that person versus what's important to that person. So how do you determine what a person really likes and dislikes if they have a different way of communicating other than using words?
That was one of the things, Craig, when I started in this field, I worried about so much. I thought, how will I ever know what's going on with people who don't use words to communicate? And I found out in a pretty big hurry that if you really listen with your eyes and ears, you're going to find out. They're going to tell you. You can tell by a smile, by how closely they stand to another person. You can tell if that person is someone who's important to them. Maybe some facial expression.
Is that part of the training?
Yeah.
So are there, and I kind of know the answers to these things, but tell me about some of the skills that you teach that can help identify what's important to that person.
Well, we look at the people who are important to them, who makes them smile, who do they maybe avoid, what are the personality characteristics, what do you see them doing that makes their facial expression relax, what do you see their personal property or things that they're things that they touch and smile about.
So that can help you help you identify people that they might like or activities that they might enjoy. By being observant and recognizing some of the subtle changes in behavior and recognizing that behavior is a form of communication and it's not always negative. It can be very positive as well too.
And I always laugh and say things. I think in one of the trainings I'm always saying, and I know that it seems like everybody with IDD has a bowling gene and they all love to go bowling, but watch and see how many people are not bowling, but they're wanting to interact with people of a similar age, their peers. They're trying to form relationships. So maybe we need to work harder at that. And it's funny because, I know bowling is an activity a lot of people enjoy, but I bet not everyone does.
Yeah, and that's a good point. It maybe not be the actual bowling itself, but just the interaction that occurs in that environment. Yeah.
Right. And the inclusion. And it's not about, okay, we all go as a group to McDonald's, staff gets our food, and we all sit with our heads down and eat it. It's we get to interact with people, a variety of people who may have a disability or may not be, so that they become more integrated in the community. And that's why it's so important that we recognize in person-centered thinking that we don't get ahead of ourselves thinking that person-centered thinking is just all about everybody getting what they want, because we have to balance it with what's important for a person.
That's another really big point, because you might think, well, sometimes people, including myself, probably don't always make the best decisions on what is important for me.
Right.
And so I might need support in someone telling me, that third piece of cake you probably shouldn't eat. But it's about finding that balance, right?
Right.
So it's not just going all the way to the other end and saying, okay, we've been very heavy in what we think is important for people to do. So now we're going to just say whatever they want to do, we're going to give them free rein. That's not what person-centered thinking is.
That's
right?
The exact opposite. That's actually, in my opinion, it's negligence. We're not helping people become valued members of the community. You and I know if we want to go down to Starbucks and get some coffee, that we're not going to butt in line.
That's right.
But, somebody with an intellectual and developmental disability might need a little help with that and support. And that's what we're doing, is we're trying to tell people and show them how to support people rather than try to fix them. A universal fix is, he butted in line and it made some people mad at Starbucks. He can't go back to Starbucks. Where maybe if we teach people and help support them in recognizing the social norms and how to wait in that line and help them build those skills, maybe they'll go to Starbucks often enough that the barista will recognize if they're not there one day, and they'll say, gosh, I wonder where Craig is today.
Yep.
And that kind of indicates that you're a valued member of the community.
It sure does.
Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, my ability is stronger than my disability. We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things I like to do on this podcast is ask people to give me 3 things in 3 minutes that we can do, that our listeners can do, that can improve the overall health, wellness, support system, network, whatever you want to address. What are important things that we can do to improve supports and services and quality of life for people that we support?
Well, as far as supports and services, is try not to.
Oh, and you have 3 minutes, by the way. 3 on 3.
Okay.
All right.
Try not to fix people and tell them what they should do. Nobody wants to be told what they should do. Immediately when somebody says that to me, I build up a wall.
What you should do, Deb, is...
Yeah, I'm not going to do that. And that's human nature. And it's the same for people with intellectual and developmental disabilities. Even if you feel they should, there's other ways to treat people and to talk to people. And it might be, hey, when you do this, it seems like other people don't respond well. Let's sit down and talk about what we might do differently. And don't treat people with intellectual disabilities who are adults like children. They're not. They're adults.
They are adults.
They are adults. And they, one of the biggest things we can do, and I won't take long with this, is we can think about the words we use. Adults don't wear diapers.
I want you to take long with that.
Yeah.
Take longer with that.
Okay.
Give us some of the examples like what you just said.
Adults don't wear diapers. We wear incontinent briefs, and that's a support. Diapers indicates that's a child. I would never, ever go out to dinner with my friends like Craig. I wouldn't say, Craig gets up to go to the restroom. I wouldn't say, Craig, don't worry. He's toilets independently, but we would talk about that. We would do that, maybe in a pudding. And that we don't need to talk about people. Introduce people like their friends. We tend to, in our society as a whole, label people and label things, and we us and them people a lot. And what I'd really like to see is people, instead of, clients, residents, participants, maybe just their people. And maybe...
How about that? Huh?
How about their name? If you can't think of anything else, say, hey, that's Craig.
People first.
Yeah, people always.
People first language is important. I think in introducing people and talking about people, is they're a person first, and they're not a diagnosis first.
Right.
And they're people can have preferences on how they want to be referred, but should have that choice as well. But in general, let's not talk about the person as a diagnosis.
Right. You don't say this person is wheelchair bound, or that person is a feeder. We all eat. That's just somebody who needs support around eating. And if we all need support. None of us are completely autonomous. Anybody who says they are completely independent, I bet they're lonely.
And we need differing levels of support, and sometimes different levels of support at different times in our life.
Right.
And there may be a time where any of us might be dependent on other people's more intensive support for our lives. That something could happen to us at any time.
Well, as I said, I retired recently, and so I'm finding myself in a group that gets othered as well, the senior citizen group. I've had a doctor say something to me one time about, well, at your age. I was like, oh, look, Skippy, that's not going to go.
I know you well enough to not say that to you, unless I just want to.
Unless we're joking, we would do that. But it's not okay. And I know that from working at an MCO that there are some treatments that at a certain age they'll say, oh, well, you're this age, so we're not going to treat you the same as we would have last year. Right? I should decide. That's it.
Yeah, or at least have an active role in it, and not have maybe set ways you do certain things just because of certain circumstances. Look at the person, as an individual, and their place, their role, their level of interaction, whatever it is, and see them as a person, and then make decisions and recommendations and thoughts and discussions that are appropriate for that situation, rather than just having cutoff points, right?
Right. And, I always have said, I am so glad that I fell into this field, because if not, I would have missed the best people in the world. The people that I've always said, when I look at people who've spent their whole lives being othered and what the struggles that they have every day, I don't know if I'm strong enough to have the nice attitudes that they have a lot of the time.
Well, I tell you, Deb, everyone has been blessed to have you in their lives all of these years, and in every aspect of it, and the service aspect of it, and the work that we've done together. It's been wonderful working with you. I'm so happy that you're getting to enjoy retirement right now, but we miss you as well. But you are going to keep your foot in the door, I have no doubt. Because it is hard. It is hard to leave totally. But I want to thank you first for being on the podcast and doing this with me and sharing your stories, but really thank you for all the work that you've done in this field.
Thanks. I appreciate that. And I loved every minute of it. And that's why you'll never get rid of me. I mean, I'm sure that eventually somebody says that, she's really getting old. Maybe she needs to go.
Well, we'll speak to you in an appropriate way and ask you kindly or suggest some other options for you.
Okay.
How about that?
That will work.
All right.
That will work.
Thanks so much.
Thank you, Craig.